Hello everyone, and welcome to my presentation. Today I will be talking about my dissertation project on mental health stigma and the role that counselling and self-care play. So, why did I choose this topic? Well, as you may already know, I'm in my second year of the MSc Counselling course at Bangor University, and throughout these past 2 years I've learned a lot about self-care and what it means to practice self-care as a counsellor to help me work with clients to my best ability. And this led me to think about how self-care is used and encouraged within counselling, but from the client's perspective. Another reason that I wanted to explore this is that it's well known that there is a great need for counselling and therapeutic services in the UK. However, mental health stigma is still very prevalent, so I wanted to explore how counselling can help in reducing mental health stigma and whether self-care plays a role in this as well. First, I began with exploring what mental health stigma actually means. So, stigma is defined as negative stereotypes placed onto a person or group of people due to a particular attribute that they have. These attributes are deemed as undesirable or socially unacceptable. So, in relation to mental health stigma, this means that someone who is diagnosed with a mental illness may be viewed and treated as though they are dangerous, inferior, or weak. So there's a lot of shame associated with having poor mental health. If someone with poor mental health is exposed to mental health stigma within society, it's very likely that they will internalize those negative labels and attributes and attach them to their core identity. This process is known as self-stigma, and this has been found to worsen mental health symptoms, for example, symptoms of depression or anxiety, as well as things like self-esteem, self-worth, and self-acceptance. Mental health stigma can be separated into 3 branches: a lack of knowledge, negative attitudes, and the resulting behaviour. For individuals experiencing self-stigma, this may mean that they lack the understanding of their own mental health or their diagnosis. They may have negative attitudes towards their diagnosis, and thus they may be unwilling to seek any help. With the presence of mental health stigma comes the absence of self-compassion, self-acceptance, self-insight, and self-worth, all of which can result in people not wanting to access support due to feeling ashamed or that they are not deserving of any help. However, 2 things that independently can increase well-being whilst reducing mental health stigma are counselling and self-care. So firstly, counselling. Studies have shown counselling to improve psychological resilience and resistance to stigma. The literature suggests that a reason for this is because each aspect of mental health stigma is addressed and challenged in the counselling setting. For example, psychoeducation can improve clients' knowledge of their mental health difficulties. Creating goals and reviewing their progress could help clients to have more positive attitudes towards mental health, as they begin to realise that they don't have to be held back by their difficulties. So you can see here that previous research has addressed these aspects of mental health stigma, and I thought it would be interesting to see how counselling may impact the behaviour aspect of self-stigma as well. Now on to self-care. Self-care refers to the management of each aspect of one's well-being, using positive and healthy practices. For example, exercise, mindfulness, getting enough sleep, or journaling. Self-care plays a crucial role in the counselling setting. Promoting self-care can help to ensure the therapeutic relationship remains professional, so that there isn't any over-reliance on the counsellor. It's also beneficial in helping clients to learn how they can manage their mental well-being in the long run. Self-care has been found to reduce mental health self-stigma. However, it's not known to what extent it plays a role in the impact of counselling on stigma. So in this study, I decided to investigate whether there was an interaction between counselling and self-care, and if so, how it would affect well-being and mental health stigma. So in order to measure mental health stigma, I looked at mental health literacy and attitudes to seeking psychological professional help. Both these variables include the 3 aspects of mental health stigma, which are knowledge, attitudes, and behaviour. So in terms of my hypotheses, it was firstly predicted that there would be positive correlations between self-care and well-being, mental health literacy, and attitudes to seeking psychological help. It was also predicted that self-care would positively impact well-being, mental health literacy, and positive attitudes to seeking help. It was predicted that individuals who have received counselling as an adult would have greater well-being, greater mental health literacy, and more positive attitudes to seeking professional help. And finally, it was predicted that there would be a significant interaction between counselling and self-care, and that this interaction would mean that having both counselling experience and high self-care engagement would result in higher well-being, greater understanding of mental health, and more positive attitudes towards seeking professional help. To test the research questions, I invited university students studying in the UK to take part in an online questionnaire. The questionnaire contained questions regarding whether participants had experience of counselling or not receiving counselling, and already existing questionnaires on self-care, well-being, attitudes to seeking professional help, and mental health literacy. The study was advertised on social media platforms as well as the Bangor University Student Participation Panel. In total, 231 participants completed the study, but after taking out partially completed responses or responses with missing data, I was left with 163 participants between the ages of 18 and 51. So here you can see the significant results of the correlational tests. It was found that there was a significant positive relationship between self-care scores and well-being. There was also a significant relationship between well-being and attitudes. And finally, a negative correlation between self-care and attitudes to seeking help. You can see that these correlations are supported by previous research, as they indicate that engaging in a lot of self-care is beneficial in both improving well-being and reducing mental health stigma. It should be mentioned here that the attitudes to seeking professional help scale meant that high scores indicated more negative attitudes. So you can kind of see that these results are what was expected based off of previous research. So in terms of how counselling and self-care impact well-being, the results showed that there was no significant impact of counselling. Self-care had a significant positive impact on well-being, but there was no significant interaction between counselling and self-care. In terms of attitudes to seeking professional help, there was no significant effect of counselling on this. However, self-care did have a significant positive impact on attitudes, and there was no significant interaction between counselling and self-care. Moving on to mental health literacy, there was no significant impact of counselling or self-care, and so there was no significant interaction found between these two variables either. So what do these results mean? Well, starting with the significant results, self-care was found to affect well-being and attitudes to seeking professional help, and this is supported with previous research that practicing self-care does have great benefits for those who are experiencing poor mental health, and it's effective in reducing mental health stigma. So these findings help to strengthen the idea that promoting self-care engagement is important in reducing mental health stigma. However, the findings that counselling didn't impact these variables differ from previous research studies, so it leads us to question why this may have occurred. This could be an indication that there are other factors involved in the influence of counselling on mental health stigma that have not yet been specifically identified. For example, the length of time that participants received counselling, or even one's experience of counselling and whether they had a positive or negative experience. These things may be factors influencing how effective counselling is on reducing mental health stigma. So this does indicate that there may be particular circumstances where counselling does improve well-being and does reduce mental health stigma, but that there may not be consistency within this. The variable of mental health literacy wasn't impacted by either counselling or self-care, which is not supported by previous research. Again, this indicates that there may be other factors involved. For example, perhaps the type of self-care engagement, or again one's experience of counselling or length of time receiving counselling, among many other things, may partially influence the reduction in mental health stigma. Also, it may be that both counselling and self-care improve some mental health knowledge that relates specifically to that individual, but not understanding of mental health in general. Both counselling and self-care can be uniquely applied to suit the individual, which makes sense, as in counselling it's important that clients are given the unique, personalised support that they need. So, as with most studies, these findings open up more opportunities to investigate other factors and considerations that may be important in the reduction of mental health stigma. And finally, we had the finding that there was no significant interaction between counselling and self-care. What this means is that individuals who have received counselling and engage in high levels of self-care may not necessarily experience higher well-being or reduced mental health stigma. So these findings indicate that counselling and self-care alone are not the only or the main influences of mental health stigma. This makes sense, as mental health stigma does not derive from these things, but from negative stereotypes and labels within society. And so these findings emphasize a greater need to further explore how can we reduce mental health stigma in a personal and societal context. And if both counselling and self-care together do not influence well-being or stigma, what positive changes can we, on a personal level, make to our therapeutic practice to improve mental health understanding and attitudes in clients that we see on a personal level? It's also important to note that there may be limitations to this study that may have influenced the non-significant findings that aren't supported by previous research. For example, the population consisted of university students, the majority of which identified as female. Thus, the sample could not accurately represent the wider population. Other factors that may have influenced these findings are that participants may not have understood what it means to engage in self-care practices, or perhaps they experienced counselling as a child but not as an adult. These things were not taken into consideration initially. Also, this study was conducted during lockdowns due to COVID-19, and this may have influenced, for example, participants' current self-care practices or willingness to seek professional help. This may have also impacted the process of receiving counselling, resulting in findings that do not necessarily fit with previous research. So, to summarise my dissertation project, I think the take-home message would be that, in some circumstances, both counselling and self-care are independently effective in increasing well-being and reducing mental health stigma. However, this is not consistent. There may be other aspects of self-care or counselling that need to be considered when investigating ways to reduce mental health stigma in those experiencing poor mental health, so that more people feel able to practice self-care and seek professional help when they really need it. Thank you very much for listening to my talk, and I hope you enjoy the rest of the conference today.